Urinary tract infections, or UTIs, are the second most common infections in humans, second only to respiratory infections. If you're a woman, it is said that we are 10 times more likely to develop UTIs than men, simply based on our anatomy. Internist Dr. Daniel Godinez explains.
Urinary tract infections are usually caused by bacteria. And the most common bacteria that cause urinary infection are bacteria that live normally in the area close to the urinary tract. Also, many of these bacteria come from the bowel, from the colon. In the case of women, because the anatomy is such that the colon and that area is always contaminated and so close to the urinary tract, then that is what facilitates the infection on them. In the case of men, the most common reasons why they develop urinary infection is because of prostatic problems. And so that is something that happens usually after the age of 40. As the prostate gets enlarged, it causes more difficulty for the patient to pass urine. And also, another thing that can lead to urinary infections in men is the presence of stones, kidney stones, which in Belize is also a common condition. Typically, we divide urinary infections in two big groups, what we call lower urinary infections, which mainly affect the bladder and the tubing taking the urine out of the bladder, and what we call upper urinary infections, which involve the kidney. Now, urinary infections, the lower ones are much more common than the upper ones.
Upper urinary tract infections may be less common, but they're also more serious.
Many times when urinary infections are not treated, the patient can develop complications due to that. For example, a lower urinary infection can turn into an upper urinary infection, meaning that the germs that go in the bladder move all the way upward towards the kidney. And then you develop an upper urinary infection, which typically includes fever, and these urinary infections, upper urinary infections, are more serious. But also, urinary infections, if left untreated, can become chronic and recurrent. And we do know from studies that many patients who suffer recurrent urinary infections end up having kidney disease, such as chronic kidney failure.
This is why the recommendation is that you should properly diagnose and treat all UTIs. The main symptom is feeling a constant urge to pee, burning or stinging pain when you pee, and lower belly or back pain. Testing for a UTI involves a simple urine test, and once diagnosed, a doctor will prescribe antibiotics.
There are many antibiotics that we can use, but another reason why a patient should go and make sure that what he or she has is urinary infection is because, if possible, we don't want to be using antibiotics unnecessarily due to the risk of resistance.
Yeah, so people shouldn't go to the pharmacy and get it for themselves.
That is something very customary in Belize. They say, I have a lip bleeding, what can you give me? Pharmacists say, well, this antibiotic will work. And it may work in the beginning, but if you keep doing that repeatedly, you will end up with a very nasty bug that does not respond to antibiotics.
There are several recommendations on preventing UTIs. Some are as simple as using the bathroom when you need to, hydrating, and even a bit of bathroom 101.
Women, many times they are trained to clean themselves from the backwards front. But when that happens, you unwittingly you contaminate with stools the genital tract, and that definitely is going to cause infections. So they really should clean themselves
from front to back.
From front to back. One of the easiest ways that your body has to carry away and clean away bacteria that may grow in your urinary tract is just by literally, physically washing them out. And in this case, drinking plenty water will facilitate that. Something that has been recommended also is the drinking things like cranberry juice or anything else that acidifies the urine, since we know that bacteria has more problems growing in acidic urines. Some have also recommended coconut water as a cleansing agent of the urinary tract, and that is also something that works.